My name's Dr. Kenneth Soh. I'm a general dentist in Kellyville, New South Wales, which is a suburb of northwestern Sydney. I grew up in Melbourne. I studied dentistry at Melbourne University there when I was still undergraduate. I finished in 2003. Then I worked a year in the Mornington Peninsula in Victoria. The turning point was when I thought actually I was going to work and potentially buy into that practice and be in Victoria the rest of my life, but moved up to New South Wales the following year. Thought it was going to be temporary, but I've been here 19 years. So I work as a general dentist, have had thoughts of specialisation, but I just enjoy doing everything too much. Dental care has changed a lot recently with modern technology and information, particularly the internet. Patients are a lot more aware of their options and a lot more dentally literate, so that a lot of times they come in asking our opinion about different treatments available and if they can have them and if they should have them. So we're dealing with a group of people there that often know what they want in the end, but don't really know how it affects their health, but usually a cosmetically driven inquiries. The most common question we get asked is, can we get teeth whitening? So with teeth whitening there, some people are suitable, but not everyone's suitable for that. There's been a really big shift from everything being on paper and analog to everything being digitized, and I've seen the change of that from paper notes, film x-rays or film radiographs there to everything become digitized. Our clinic, we embraced digital technology very early on, from digital photography to digital radiographs, so we have intraoral sensors, so we end up with instantaneous information. We also have a digital OPG, and in the same unit there we can take digital cone beam images. Digital cone beam has probably been the biggest change recently, where we can have 3D reconstruction of what we see clinically in the mouth and what we don't see clinically in the mouth there. 3D technology, especially cone beam, actually gives us far more information than small intraoral radiographs and OPGs ever did. That we unfortunately see a lot more abscesses underneath teeth, which we couldn't see previously in OPGs, and I think it's probably led me personally to refer more endodontics out to endodontic specialists. We also have embraced the digital scanning, so we have the 3D scanning there, and we're not yet sort of putting them together, but I know there are lots of ways that dentists can use 3D scans and 3D radiography to help place implants, to also do cosmetic dentistry as well. One of the pleasing things to see recently is the increased dental literacy of general practitioners, so medical general practitioners, that they're aware of a particular issue called medication-related osteonecrosis of the jaw, which is important in osteoporosis management. So often now the doctors will send patients who are about to start on anti-osteoporosis medication to the dentist to get checkups. That's one out of many things that people may need to get a dental clearance for. Dentistry is a long and hard journey at the moment there. When I trained to become a dentist, the times were quite different. That was 1999 was my first year at uni. The requirements were quite different back then, that dentistry in almost all the universities around Australia was a 5-year undergraduate degree, and then if you chose to specialise, you could spend 3 years doing all the other specialties of dentistry, and then it would be 6 years to become doubly qualified as a doctor and a dentist to do oral maxillofacial surgery. These days there's a lot more choice, that there are more universities offering dentistry, but even with all of that it's become very, very competitive, and the training regime has actually changed. So some dental schools still offer a 5-year undergraduate program, but a lot of the major universities are heading towards a 4-year postgraduate program. So it requires you to have done at least 3 years of an undergraduate degree beforehand. Specialty training is still quite similar, so 3 years postgraduate, you just get a different letters after your name afterwards, but to become oral maxillofacial surgery, it still requires you to go through medical training as well. The minimum requirements to be a dentist there is registration with the Dental Board of Australia, which is done through APRA. Professional organisations that you can join there are not compulsory, but a lot of joining them is a good idea, particularly if you have an interest in any specific area of dentistry. So the biggest and most well-known is the Australian Dental Association, but there's not 100% membership among dentists. There are different societies, so there's this Australian Society of Endodontics, Orthodontics, Prosthodontics, and local regional study clubs as well. So you can join membership with a lot of those. There's local study clubs there where you can discuss cases, but they're not requirements, but they're professional organisations that you can be affiliated with. Ones that I'm affiliated with is the Australian Dental Association, that pay membership. I'm involved with another one called the Christian Medical and Dental Fellowship of Australia, and I have been associated with the Australasian Sleep Association, so that's a particular area of interest of mine in the past. I love working in dentistry because I do enjoy interacting with people, working with people, helping them get their dental treatment done in a non-threatening way. It is a hard journey to become a dentist now, especially that now you probably need to be at university for 7 years before you can start working as a dentist, 3 years undergraduate, 4 years postgraduate. It was different from when I was as a new dentist. There were only 5 years of dental school. So I'd recommend do dentistry, become a dentist if you really love working with teeth, with people. You get to combine both science and art, your artistic flair, but you need to really enjoy working with people. That said, I love dentistry. I come to work every day, happy to come in along and help people with their needs. Be careful with choosing dentistry purely on the financial reward, because there are much better ways to make money. But I think dentistry, if you love working with people, love teeth, love all this gear I have around me, all the technology, that dentistry could be the ideal career for you.